Hey, have you ever thought about how tricky it is to diagnose asthma in kids? I was just
Yeah,
reading about it. It's really fascinating.
really? What's so tricky about it?
Well, asthma symptoms can overlap with other conditions, so
Hmm.
doctors have to figure out if it's asthma or something else.
Oh, so what kind of conditions are we talking about?
Things like rhinitis, sinusitis, even acid reflux can
Right.
mimic asthma symptoms, so it's not always straightforward.
Wow, I had no idea. So how do they actually diagnose it then?
They use lung function tests like spirometry, which
Oh,
measures
okay.
how much air a child can exhale and how quickly.
But wait, can young kids do those tests?
That's the challenge. Kids under 5 can't usually do them accurately, so doctors
Yeah,
rely on symptoms and history instead.
that must make it harder to treat, doesn't it?
Exactly. So sometimes they use a wait and see approach for toddlers with mild symptoms to
Right.
avoid unnecessary medication.
Speaking of medication, what kind of treatments are available for kids?
There are long-term control medicines like inhaled corticosteroids
Hmm.
and quick relief medicines like short-acting beta agonists.
Are there any concerns with giving steroids to children?
Well, there can be slight effects on growth, but the benefits usually outweigh the risks,
Yeah,
especially when asthma is well controlled.
that's reassuring. What about allergies? Do they play a role in childhood asthma?
Definitely. If allergies trigger asthma, allergy tests and treatments like immunotherapy can help reduce
Right.
symptoms.
So it's a combination of managing symptoms and triggers, huh?
Exactly. And using an asthma action plan can make a huge difference in keeping
Hmm.
everything under control.
But don't you think sometimes we rely too much on medication?
Well, I see your point, but controlling inflammation is key, and medicines
Yeah,
play a big role in that.
true, but what about alternative methods?
Oh, like breathing techniques? Those can complement treatment, but
Right.
shouldn't replace it.
Got it. And what can parents do to help their kids besides meds?
They can reduce exposure to triggers, like dust mites and pet dander, and keep
Hmm.
indoor air clean.
Makes sense. And supporting the child emotionally is important too, right?
Absolutely. Being encouraging and keeping things normal helps the child cope better with asthma.
Yeah, this has been really enlightening. Thanks for sharing all this.
No problem. It's a topic I'm passionate about, and it's important to spread awareness so parents can
Definitely.
help their kids thrive despite asthma.